Alicia Kelly, a primary care physician and obesity medicine specialist. Great to have you here in studio, doctor. Okay, so I'm curious to know, when you saw this landmark trial, what was the reaction by you and, of course, your colleagues? Like, what were you saying to each other?
Oh, we were so excited because this is what we've been looking for. We've been really trying to find out just the health benefits, the cardiovascular benefits of this medication. So we were just so happy when the results came out.
How significant is 20% reduction in people's risk of cardiovascular events?
Extremely significant.
Yeah.
So we see this when we add on a cholesterol medication called a statin, where it reduces their risk. And so now this is on the same playing field.
So we heard Meg Terrell mention that key question about the initial results of the study, whether or not the lowering of the risk of heart attack and stroke, if it's directly tied to the medication itself, or if it's tied to the fact that you're losing weight, and hence, of course, you reap the benefits of that.
At this point, we're not quite sure whether that's the case, but if you look at for the patient, the common patient, they just want to feel better.
Yeah.
So it doesn't really matter right at the moment.
Are they looking at that, though, to potentially use this as a standalone drug to treat heart attacks or heart disease?
Yes. So this could be, I think this is where more research needs to be done,
Yeah.
because this could actually be seen for somebody who has heart failure and is a normal weight. The question is, could this medication be used to help improve their heart failure and reduce their risk of heart attack?
So you're an obesity specialist. So, like, how does this impact you and your practice and when you see patients?
I already have calls.
Yeah,
People
I
are
bet.
calling me and saying, listen, I want to get on this medication. But it helps because I see patients who have like chronic heart failure, who've had cardiovascular disease, and there's certain medications on the market where they just can't actually take. And so this just gives me another option to help them to, first of all, that's going to help their heart, and then secondly, allow them to lose weight and have a better quality of life.
There's a lot of drugs out there now, right, related to specifically weight loss, and that would be Ozempic and Wegovy.
Yes.
But you also have another class of drugs, Zepbound and Mounjaro. How are they different? Do we know, like, how they work differently?
Well, they target different hormones in the body. So Wegovy targets the one gut hormone, whereas the Mounjaro and Zepbound targets two gut hormones. So it just covers a little bit more, but they're in the same class, similar class.
Okay, so when a patient comes to you and says, well, which one should I take? Is it just whichever is available to them?
So it is. It's
Okay.
which one insurance covers. Eventually, we're doing studies to look at them head to head, which one will be better. But it's just, what can they afford?
Lastly, importantly, there are risks involved, however, or there are some side effects to this. And so who are the patients that should not be taking these drugs?
Definitely patients who have a pre-history of like GI issues, gastroparesis. They should not be on this medication. If you've had a history of acute pancreatitis, it really is not contraindicated, but it really needs to be monitored closely. And if you have a family history of medullary thyroid carcinoma or MEN2, you should not be on this medication.
Wow. So I would imagine that has your prescription writing for Wegovy or...
Oh, it's off the roof.
Is it really?
Yeah, so people come in and like, I want the shot. And I'm like, well, let's talk about the pros and cons of all the medications.
I mean, and it's too early to tell now, but the overall impact on the health of our society, I mean, it could have profound impacts on that down the line, right?
Definitely.
Yeah.
As the years have gone on, obesity has increased. And so if we can be able to stop, or not even stop, but just reduce obesity, we can be able to reduce somebody's risk of mortality and improve someone's quality of life.
Dr. Alicia Kelly, great to see you. Thanks for coming in.
Thank you.